As a frontline doctor, I've seen many cases of flu. I know how unpleasant it can be.
The flu vaccine has been shown to help prevent people catching the flu.
As a patient, my expectation of staff would be to have the flu vaccine so that I would be in the safest possible environment.
My message to all staff within DPT would be to absolutely have your flu jab.
Flu is a highly infectious illness which can cause mild symptoms through to serious complications and occasionally death. It is often underestimated how serious this infection can be and how easily it is to transmit.
We have had outbreaks of flu in our inpatient units in previous years. When this has happened, it's been very difficult for individuals who have suffered from flu, but also for the ward to manage.
Last year we were one of the wards that were hit by the flu, which resulted in us having to shut to admissions. We had a number of patients and a number of staff members who were affected by the flu. This put pressure on the staff that were still working, but the main people that were affected were the patients.
Speaking as somebody who has had the flu, I can attest that having something so awful happening to you physically takes a toll on how you're doing mentally.
So last year we had 4 confirmed cases of flu. One particular gentleman lost the ability to use his legs and walk. He was so badly affected we had to hospitalise him twice.
We had individuals who took to their bed for a number of days just because of obviously the severity of their symptoms. We had to sort of barrier nurse individuals within the ward. It was a really tough time.
Going into a busy general hospital can increase their stress levels, so we want to avoid hospital admission if we can. When we hospitalise patients, we also have to take staff away from the wards in order to accompany them, and that adds additional stress.
We base the flu vaccine in the UK on what's been happening in Australia in their winter. The flu has been severe and has started earlier in the season. We're trying everything we can to prepare to prevent this from happening here in the UK.
And the vaccine is definitely something that I see as valuable.
My message to all staff working at the Devon Partnership Trust is to have the flu vaccine.
It doesn't hurt, you don't get the flu.
I feel I have a duty to have the flu vaccine.
It helps protect yourselves, but also helps protect the people that we care for.
As a patient, I want to come to an NHS that is as safe as possible. Please just have the flu vaccine.